All right, so starting off with our bases of tissue.
No way.
Yes, way. Injury slides, okay? We have 3 phases of soft tissue healing. Now, what do I mean by soft tissue? What do you think falls under? Out of those categories of tissue that we learned in anatomy, what is soft tissue? What do you think? We had 6 types of tissues that we learned. Or hopefully you learned from the test that you just took. Lauren, can you give me one?
Cartilage?
Do you think cartilage is probably soft tissue? Yes or no?
Yeah.
Yes. It's cushion. I hope it's soft. All right, so we got cartilage. Lauren?
Skin.
Skin. Do we think skin is soft?
Yeah.
Okay.
Unless you have it like dry skin.
Unless you got dry skin. Or some other crazy stuff going on there. Yes. All right, so right now we've got soft tissue being cartilage, and we've got soft tissue being skin. What else? What else sounds like it might be soft? Stephanie, you want to throw a guess out there?
Muscle?
Muscle. Muscle soft?
Short? No.
You think it's soft?
Yeah.
Soft?
Yeah.
Yeah, it's soft. Okay. So we've got muscle. What else? We've got half of them so far. So you've given me half of our original 6. Any of those other ones? What are we missing? Okay, we have bone. Is bone soft or is bone hard?
Hard.
Okay, so we're gonna put bone over here. Okay, what else are we missing? Stephanie? Tendons. All right, we're missing tendons and we're missing what? Ligaments. Okay. Can somebody remind me what tendons and ligaments do? Jada? Okay, ligaments connect bone to another bone, and tendons connect bone to muscle. So they're kind of like rubber bands, right? Okay, so are we going to say that they are soft tissue, or are they going to be more like bone?
Soft.
They are. Okay, so of those 6, 5 are soft tissue. All right, pretty easy, right? You're either soft tissue or you're bone. Bone kind of gets their own little category. Okay, so soft tissue healing considers any injury to cartilage, skin, muscles, tendons, and ligaments. All right, that's kind of a lot, right? Okay. My question to you guys is, can you have an injury to more than one of these types of tissues at a time?
Yeah.
How? How? How can you have an injury to more than one of those tissues at a time? What do you think? Somebody want to volunteer an injury that they've ever had? Jada, what do you got?
When you like tear your ACL.
Okay, we have torn ACL. Does anybody know what ACL stands for? Okay. Well, the L is a ligament, okay? So it's anterior cruciate ligament, okay? So if you tore your ACL, what else happened? That ligament is torn. Okay. Do you know who the person directly? Okay. So that ligament is torn. That rubber band is split in half. Okay. Was there any other damage? Do you know?
Scar. Because they had to get surgery.
Okay. So they had to have surgery. So they have a scar. So what other one of those soft tissues could be damaged? Skin. Okay. What else do you think might go along with that?
Their cartilage is gone.
The cartilage absolutely could go. Muscle could absolutely go on. So usually, more times than not, when you have an injury, it's going to affect more than just one of these. Unless we have a paper cut, that's pretty much going to be skin only. Okay, but pretty much you're going to have a little combination of all of these. Okay, so we're going to start with soft tissue. There are 3 phases. Acute inflammatory is the first one. Does anybody have any idea what acute means? Not like, oh, how cute. Acute. Small, or it means small and something else.
Less than
I'm sorry?
I mean, that's
Okay. It means small, or it means a new injury. Okay, so if I'm walking and I sprain my ankle right here, it is a new, fresh injury. It's acute. Okay, well that's why it's also in that first stage of healing. All right. The second phases are repair and remodeling, and we're going to explain what goes on in all of those stages. So if I just sprain my ankle, what's going to happen? If I take my boot off, what am I going to see? Okay, I could have some swelling,
Bruising.
I could have some bruising.
Blood.
There could be blood.
Bones.
There hopefully is not, but there could be a bone sticking out. Anything else? Am I going to be in pain? Yeah.
Oh, yeah.
I'm going to be in pain. Am I going to be walking funny?
Yeah.
Maybe limping? Okay.
Oh,
Go ahead.
Would it have numbness?
I could absolutely have numbness. Okay. All those are possible side effects of that injury. So our first phase here is that acute inflammatory. And what's the difference between the hand on the left and the hand on the right? One's really, really swollen. Right? Ah. What else? What else is wrong with the hand on the left versus the hand on the right?
It's like it's swollen.
It's swollen. What else is wrong?
I'm sorry.
It's red.
It's red, discolored. Okay, absolutely. So looking at those pictures,
You can't see the veins.
you can't see the veins,
Oh,
right?
yeah.
Because it's all swollen. You can tell, right, which one's the injured one and which one's not.
They both look.
Okay, they might not have, they might need a manicure. It's fine. But which one looks like the injured one?
The
left one.
The left one. Okay, and you can tell that because of those signs, like the swelling. All right, it's red, it's puffy. Okay, it kind of has that shiny tint to it. Okay. So what happens in stage 1? Okay. We have an injury, and it doesn't matter if it's my sprained ankle, if I smashed my hand in the car door, it doesn't matter. We have a rush of blood goes to that injured area, okay? So I roll my ankle, instantly my body knows it, and it sends new blood down to that injured site, okay? What does blood bring? What's in blood? Nutrients, all right? Like what? Can you name a nutrient? Oxygen, number one thing. Perfect, okay? Number one thing is that the new blood is bringing oxygen. Well, just like your cells inside your body need oxygen to survive. So if we don't have oxygen, what's happening to our cells?
They're dying.
They're dying. Okay, different question, Taylor?
Yeah. Have you ever if something gets swollen, when does it get so hot?
I'm gonna tell you about that.
Oh.
I'm gonna come back to that. Don't forget that question, okay? All right, so because we have this injured area, all right, we need the nutrients to come help speed up our healing process. So we have that increase in blood flow. We also have these things called phagocytes. All right, everybody say it for me. Phagocytes. One more time. Phagocytes. Okay, and what they do is they eat up the dead tissue. All right, it kind of sounds gross, but if we have damaged tissue in there, we got to get that out so we can start healing. Okay, so the phagocytes, I always think of every one of our little cells kind of as like little Pac-Man. Okay, and they just go in there and they just start eating and eating and eating. Okay, so our phagocytes go up there and they eat up the dead tissue. All right, we've got leukocytes, which come in with our white blood cells and help to fight any infections. Okay, we see this a lot with open cuts. How many of you guys have had a cut and there's pus? All right, ew, pus. Okay, that pus is that white blood cells. Okay, that white blood cells, it's there fighting infection. All right, I'm gonna get gross for a second. Okay, how many of you guys pop your pimples? Okay, well, what happens with the white? What's the white stuff on top? I've never been gross. I gave you a warning. Okay, what's the white stuff on top? 70? The white blood cells, right there. It's the white blood cells that are in there. What? Fighting infection. Okay, so when you pop it and you get that white stuff out, what happened to my infection-fighting blood cells that are in there? They're gone. They're on that napkin that you just threw away in the trash. Okay. So actually, you're not supposed to pop your pimples, just because they're in there doing a job. Those are in there fighting off infection. So if you remove that stuff, what are the chances of you getting an infection doing?
Very hungry.
Going up. Going up. Okay. Just my little public service announcement today. Okay. Don't pop your pimples. Okay. All right. Another things that we have going on inside of our body during this first phase is platelets. Okay. Platelets are in your body. They are helped to clot your blood. And what clotting your blood means is to help you stop bleeding. Okay. How many of you guys get nosebleeds really, really bad? Ooh, I did when I was a kid, for sure, okay? And they just would not stop, okay? Platelets are naturally in your body that help to allow your blood to stop bleeding in a reasonable time. What happens if I get punched in the nose today and my nose just does not stop bleeding? What do you think could happen to me? I could bleed to death, right? I've lost so much blood that I could have a lot of other problems going on just from getting punched in the nose, okay? So we want those platelets in our body to help fight the blood to clot. The acute inflammatory phase lasts for about 2 days. Okay, so this kind of depends on how bad the injury is. Okay, if it's my little my paper cut, it is going to be closer to 1 day than 2. All right, but if I just had surgery, it's going to be longer than 2 days. All right, so 2 days is just kind of our estimation. So some signs of inflammation. All right, there's redness. Okay, well, does anybody know why it's red? What could be causing it to be red?
Because the blood's rushing.
Because I just learned on that last slide that there is blood rushing to that area. So Lauren, you're exactly right. Okay, that redness comes from the increase in blood flow. Okay, there's swelling from that increase in blood flow, and we are going to use big words in this class. Swelling, the proper medical terminology for that is edema. Okay, how many of you guys watching like the Grey's Anatomy and Code Black and all those shows? Okay, you guys will start hearing terminology that you recognize in those shows. Okay, in some injuries we have bruising, and that's a sign of inflammation. The discoloration, the medical terminology word is ecchymosis. Let's say that word. Okay, ecchymosis. Ecchymosis. Okay, and that's just discoloration. All right. The last thing that we usually see on a sign of inflammation is that it's warm to touch, okay? Well, do you think our blood is warm or cold on the inside? Cold. You think it's cold? What happens to liquid that's cold versus liquid that's hot? When liquid, where's my water bottle? Hold that thought. Oh, let's use my little Scentsy thing. Okay, so when I get into class and I plug my little Scentsy in, it goes from a solid to a what? Liquid. So it is warming up, causing that little liquid to run all over this place, right? Okay, so if I have this liquid and it is cold, what happens to it? It gets solid, it's thicker, right? How do you think thick blood runs through our body? Very well? No. Okay. So your blood is warm. All right. Your blood is warm. That is why it is the warm to touch area. When you have that, if I'm touching that guy's puffy eyeball right now, okay, it is going to be warm. Okay, because the blood is naturally warm because it needs to be able to flow all through our body. Okay, stage 2 is called the repair phase.
It's 1 o'clock.
In the repair phase, we have a whole lot of different cells in our body. Okay, so we are few more days out. This is my sprained ankle. Okay, in this we have fibroblast and we have fibroclast. Okay, big words. Okay, fibro is the fancy word for soft tissue. Fibro. Okay, so tomorrow when we talk about bone, it's going to be a different word. Okay, so anytime you see the word fibro, all right, it's soft tissue. It can be any one of these 5. Okay, fibroblasts build up. So fibroblast, B for build up. And what that means is they are in there rebuilding tissue. So if I had damage to my muscle, those fibroblasts are in there making new muscle tissue. Okay? If I had a scrape on my knee and I lost some skin, those fibroblasts are in there making new skin. All right? They are building up tissues. All right? The other one that we have in here is fibroblast. All right? And the clast eat up dead tissue, just like those phagocytes, alright?